Well, we believe that every nurse is an educator. And so, because we're all nurse educators, what we want to do is really embrace the opportunities that we have to educate our patients, even our fellow colleagues, making sure that we embrace that experience by building a solid foundation of knowledge. So, that's where it has to start.
Welcome to Nursing Beyond the Bedside. I'm Audrey, your host, and a nurse who pivoted my path several years ago. After 8 years as a critical care nurse, I was ready for change. I craved higher pay and more flexibility, but was struggling to find a clear path forward. Fast forward through positions in recruiting, customer success, and marketing, and many lessons learned along the way. Today, I run Pivot Path, a company dedicated to empowering nurses to redefine their careers. This podcast is designed to help you navigate the journey from clinical bedside nursing to a fulfilling career that aligns with your passions and goals. Here, you'll discover inspiring stories from nurses who've gone beyond the bedside, successfully transitioning to non-clinical roles, or redefining their nursing career. Join us as we hear their stories and share actionable strategies to help you make your own leap. Whether you're a new listener curious about what lies beyond the bedside, or a returning audience member in need of some fresh motivation, this podcast is your go-to resource for exploring new opportunities that can transform your career. Let's get started. Today's episode is for every nurse who's wondered if their teaching skills could create impact beyond the bedside. I'm excited to welcome Dr. Bridgett Sellars, who transformed her 30 years of nursing experience into a thriving business that's reshaping nursing education. As a certified nurse educator, board-certified nurse executive, and fellow with the American College of Healthcare Executives, Dr. Sellars has served in pivotal roles from Chief Nursing Officer to RSN BSN Program Director. In 2021, she founded Dr. Sellars Educate, a company dedicated to helping nurse educators advance their teaching skills and achieve classroom excellence. Whether you're considering education as your next career move or simply curious about how nursing education is evolving, today's conversation might inspire you to think differently. Dr. Sellars, welcome to Nursing Beyond the Bedside.
Thank you so much. I'm happy to be here.
Yeah, absolutely. You have such an impressive career over the past few decades in nursing. Can you kind of give us a high-level overview of your journey from kind of where you started and how you ended up in education?
Sure, I'll be happy to. Well, my pathway is not very traditional. I actually knew I wanted to be a nurse since I was a very young child. I was raised by a single mom. I also had 3 generations in my household. And so I was exposed to a lot of different things early on. And one of the transformative experiences for me as a young toddler that helped me really identify where I wanted my career to go as I grew up was the influence that a nurse had on me as a young child when my mom was in the hospital. So I knew early on I wanted to be a nurse. It was just the impression that she made upon me. I was very caring. I can remember her bending down and talking to me as a young child. I was very afraid with my mom being in the hospital. And in those days, you could take your children to the hospital and family could leave and it would just be the patient and the child. And so I can specifically remember her offering me something to drink. And it was just the caring spirit that she had. And I also remember that she had on this starched white uniform with her cap. And I was so impressed with how professional she looked and how she carried herself. And so that led me into my nurse educator journey, where I chose to go to University of North Carolina at Greensboro for my nursing education. And I chose that school back then because I did my research and I knew they had a really good high NCLEX pass rate. And so I went for a campus visit. I was super impressed with the campus and how welcoming it was. And I went there for my BSN. I knew early on that I wanted to achieve my terminal degree. I know that may sound weird, but a big influence on me was the faculty that I really had a chance to get to know, not just on a professional level, but from a personal level. And so they talked to me about their career journey, and I quickly aspired to be just like them. And I segued into the bedside position as a cardiac staff nurse because my family has such a strong history of heart disease. So that's really what drew me specifically to cardiac nursing and to intensive care. Well, shortly after starting my nursing practice in 1995, I knew that I needed to engage in lifelong learning because there's so much to learn about the cardiac system that I didn't know. I transitioned into the critical care setting for a level 1 trauma center and became a charge nurse, an educator, critical care nurse educator. And then I got introduced to academia once I completed my master's degree. Once I completed my master's degree in nursing education, my next step was to get my PhD. And I knew I wanted to learn more about how to be a really good researcher. I was always very inquisitive with my faculty, so I can appreciate those students in the classroom that have the same experience with me. And so research was intriguing to me. There was a lot I didn't know. And that landed me at the University of San Diego. My husband's a retired Marine. We were stationed there. And so they had a PhD program in nursing research. And I chose to go to that university because it was a stellar university. And again, it was just a great impression I had from all the faculty and the dean there. University of San Diego is where I had my first official opportunity to transition into academia. I started as an adjunct while I was completing my PhD. And once I completed it, I decided to accept a tenure track position. So that's a little bit about how I got into nursing and what has kind of led me into nursing education today.
What I love about that story is it sounds like you had some really standout role models kind of each step of the way, kind of guiding you down your path. So that's pretty incredible. Was it your experience at San Diego that sparked your passion for nursing education and realizing that you wanted to be an educator, or had you kind of already reached that realization prior to that point?
Yeah, that's a great question, Audrey. Actually, I had an interest in education when I was in high school. So I was in Health Occupation Students of America. And a lot of work that we did was related to teaching the community about their health. And so I actually attribute that experience in that club and being a very active youth member in my church where we did do a lot of community service. That's really what started me to be interested in education in general. And then I would say when I went to UNC Greensboro right away as a nursing major, me and one of my best friends to this day, we always were responsible for the health fairs on campus. And so that involved community teaching as well. And then the actual professional setting, when I became a staff nurse, I immediately became a charge nurse and a preceptor. And so I think that really developed that foundation for me and passion around nursing education and helping others. I can remember as a new grad how anxious I was about being on the floor and learning everything that I needed to learn. And it really was having those great preceptors along the way, having great charge nurses that helped mold and shape me to make safe patient care decisions. And so I wanted to give back. So I would say my charge nurse experiences and my preceptor experiences are what really helped me kind of solidify what my path was going to be related to helping others through education.
Mm-hmm. And you mentioned that especially in cardiac ICU, there's always something new to learn.
Yes.
And I think that's true of nursing in general. It can sometimes feel like an unsurmountable, mountain to climb. But I think that having those like unit educators that are really involved and people who are on your unit who you feel comfortable asking questions to can be so important. And right off the bat, you had these experiences of like teaching others on your unit. From your clinical nursing role, as you transitioned more and more into education and leadership positions, do you feel like there were any specific challenges that you faced during that transition?
Yes, I think there were definitely challenges along the way. And because of my passion for evidence-based practice and research, I really looked at them as opportunities. I think the biggest challenge for me was finding mentors. So even though there was a structured onboarding process and orientation, I still found, just like Patricia Benner talks about, that there's this whole novice to expert pathway that you take. So it's beyond that 12 weeks of critical care orientation or whatever that looks like. So for me, the toughest part has been finding mentors. Even to this day, that's something I'm very passionate about because I think that's what helps sustain us during those tough times is having that mentor, having that confidence that you can really reach out to not only kind of give you some advice, but also to be honest and transparent with you about what your next step should be.
Mm-hmm. And I'm glad that you mentioned that because mentorship comes up a lot on this podcast. A lot of the guests who have been able to pivot and follow their passion and do something new with their career have had a really influential mentor in their life. And I think that what you're calling out about the difficulty finding a mentor, I think that's a really common struggle for nurses. I'm not sure if this stems from the culture that we sometimes have, like that we eat our young, or that, I know I've experienced this myself where I've been working on a unit and the culture around me has not been one where it's like safe to ask questions. You kind of feel inferior if you're asking questions as if it's something that you should already know. And so something that I think is so important is nurses should be able to feel safe asking
Yes.
questions because that allows them to provide safe care. Like if they're afraid to ask questions, that's how mistakes happen.
Absolutely.
Do you have any thoughts on like how we as nurses, whether it's someone who is a charge nurse or a nurse educator, or even just a staff nurse on a unit listening to this podcast, do you have any thoughts on how we can encourage more of a culture of learning together and mentorship on nursing units?
Yeah, so I have lots of thoughts. I think that education really is our foundation. So if we as faculty in academia can create that culture of mentorship where we're not only talking about it, so there's a component in our curriculum that talks about mentorship, but we also role model it. So an example could be when students are completing their transition to practice course or that final course in the semester, talking to students about the importance of, yes, preceptorship is important. We talk about that. We talk about being a charge nurse, but we don't often talk enough about mentorship. And let's be honest, the reality is every great nurse, every great leader is not going to be aligned with some of those mentorship responsibilities. So I think it starts with education, as looking at our curriculum, seeing how we can develop that culture as we have these future nurses coming through our academic setting. And then the second responsibility I think is we have as faculty and as leaders is to be a mentor, to identify what are those specific characteristics that I need to have in order to effectively mentor. With my company, which I'm sure we're going to talk about as we continue our conversation, that's a big part of what we do because we saw there was this huge need in academia related to mentoring, even though our mission is to support all faculty to help them achieve excellence in the classroom. Well, a big part of that has been building relationships, trust in relationships, as you mentioned, where there's a brave, safe space where faculty can speak up and say, you know what, I'm struggling in this area. How do you recommend I pivot? Or how do you recommend that I integrate these evidence-based strategies so that my students can actually learn? So that's what I would say, making sure from an academic standpoint that we're looking at opportunities where we can really breathe this foundational concept of creating this culture of mentoring, and then making sure that we take responsibility to be really good mentors ourselves, even if we have to work on certain areas that we currently have within our toolkit. If there are some tweaks or modifications that we need to make to be a really good mentor, I think we all have the responsibility to do that as well.
And that actually is the perfect bridge. I want to talk more about Dr. Sellars Educate. Tell us a little bit, give us kind of an overview of what you do, the programs and services that you offer.
Yeah, so Dr. Sellars Educate, as you mentioned, was actually launched in January 2021. It had actually been a concept that I had spoken about, had actually been engaged with faculty in different roles that I had, and educators, so clinical nurse educators, and in a hospital setting as well, just related to the certification journey and how to transition from being that really new nurse educator to achieving that higher level of expert. And so as a company, there are 4 actual nurse educators that also are part of my advisory board. And so as we talked about what the needs were in academia and helping us transition to practice, as an experienced nurse coming into academia, we knew that there were some specific competencies that we needed to achieve. Well, going back to our previous conversation where it comes to mentoring, there's not always a lot of mentors that are available. And so what we decided is we wanted to fill the gap. And so we developed curriculum that specifically hones in on what skill sets does that novice nurse educator need, ultimately helping them get to the point where they have achieved competencies and they're ready to take the certification exam. So it truly is faculty development across that continuum within their entire nurse educator career.
Gotcha. And can you outline a little bit like what the path to become a certified nurse educator looks like? If there's a listener out there who's maybe working at the bedside now and has an interest in education, what steps might they be thinking about as they look ahead?
Well, we believe that every nurse is an educator. And so because we're all nurse educators, what we want to do is really embrace the opportunities that we have to educate our patients, even our fellow colleagues, making sure that we embrace that experience by building a solid foundation of knowledge. So that's where it has to start. So some of that really is taking an honest look, doing a self-assessment of where your knowledge gaps are as it relates to the conversations you're having with patients, as an example, or the gaps that you have as a charge nurse or as a preceptor, or maybe you're interested in becoming a critical care nurse educator or an educator in your hospital setting. So that's the first step, is just doing a self-assessment about where your knowledge is today, what your knowledge gaps are, and then how are you going to fill in those gaps to help bridge what we call the theory to practice gap. So ultimately, we want to take a look at what the evidence says about our patient care practices, about our educator practices, and then we want to figure out, how do I implement them? So how do I move to that next level so I can achieve that highest level, which is expert? So I would say first and foremost is thinking about where you are today from an experience standpoint. And then that second step is formal education, because the need in academia really is to have that master's prepared nurse educator. So that's what I would encourage, is looking at educational opportunities for you to advance your education as the next step. And then that third step is really what we do here at Dr. Sellars Educate, and that is that we coach and support and guide other colleagues across the country to help them achieve success. And a big step in that process is making sure that we're developing that relationship. Having a trusting relationship with the mentor or with a coach is critically important, whether you're a new nurse or you've been a nurse for 30 years like me. I still have a coach. And so you want to make sure that you're thinking about where you are today. How do you make sure you have that specific information that you need to advance your knowledge, getting your advanced education? And then that's when we start working with you to really coach and support you to cross the bridge into achieving certification as a nurse educator.
And I love that you mentioned the coaching aspect and that you work with a coach. I feel that sometimes as nurses, we are so used to, we graduate, we get employed somewhere, our certifications are kind of like laid out for us by our employer. We kind of have these boxes that we need to check for our professional development, and we just kind of do what's laid in front of us. But I think that what's important to call out about coaching is there's this extra investment that can be made in professional development to really get yourself from point A to point B. Can you share a little bit about how maybe your own coaching experience, or how just coaching in general, can really help lever up a professional from like where they are to where they want to be?
Well, I think it starts with us individually figuring out what that looks like. So in nursing, we have so many great choices, which is wonderful. So you have to have that honest conversation with yourself to figure out, what is it that you want right now? And that's the other thing that's great about nursing. You can decide that you want to map out a specific journey for yourself today, but in 5 years and sometimes in 2 years, it can look different. So that's where you want to start, is figuring out what is it that you want to do in this phase of your nursing career. And then the second step is to engage with professional organizations. So based on where you are right now with your specialty, and you want to think about what your interests are in moving forward, I would highly recommend you affiliate yourself with a professional organization that is going to automatically have experts there. And that is also a great opportunity for you to engage with mentors. Networking is critical in nursing education and in nursing in general, because the nursing world is very small. Even though there's millions of us, it's very small. So when you're engaged with those professional organizations, automatically you're going to connect with a lot of colleagues across the country that may be your next mentor. So that's what I would say: getting connected, networking, putting yourself out there, going to these conferences, joining different webinars, just staying active, not only in your current area of specialty, but thinking about where you want to go next. Consider tapping into those resources as well.
I'm hearing an overarching message of being proactive, from identifying, those education gaps in yourself that you mentioned, and seeking out that next level of education, to, becoming involved in professional organizations, networking, finding a mentor. All of that takes like a certain amount of proactiveness that I think is important to call out. And so in building Dr. Sellars Educate, I always like to dive into a little bit just like the entrepreneurial aspect of building your own business. I think nurses make fantastic entrepreneurs. We have so many skills from our bedside experience that translate into that world. What has kind of been like the most rewarding aspect of entrepreneurship for you in building Dr. Sellars Educate?
Well, for me, the most rewarding part is exactly what I expected it to be. And that is when you have nurse educators who are excited about the changes that they've been able to implement into their classroom to improve the learning experience for the student, but also for themselves. I think that one of the biggest myths is that as educators, we just show up and teach, but there's so much more that happens behind the scenes, the countless hours that we dedicate to reviewing content, not only that our students are reviewing, but also additional evidence to make sure we're creating these rich learning experiences for our students. So I think that when we consider what our next steps are going to be, whether that's at the bedside or in the academic setting or in a leadership role, you really want to do that self-assessment to figure out what your next steps are going to be. So for us at Dr. Sellars Educate, we knew our mission early on was very clear. We wanted to help nurse educators achieve success. But what we didn't realize is about that transformational process that's on the journey to achieve CNE. So yes, we get excited when we hear nurse educators say they passed the exam. We have a 98 to 100% success rate when following our CNE in 60 days program, which is trademark unique to our pathway that we develop with our nurse educator colleagues. So I would say it's twofold. I think it's exciting when colleagues say, thank you so much for helping me to pass the exam. But the second part really is when they tell us, you know what, I learned about Poll Everywhere and I started using it and the students were so engaged. I think that's really what brings us the most joy.
Yeah, that's awesome. It's something special when you get to just kind of chase down your passion and see the outcomes of that and the effect it has on other people. I know that is just so fulfilling.
Yeah, it is. It's exciting.
Yeah, definitely. And, I think that as far as where we are in nursing and how technology is really becoming such a important part of healthcare implementation, the last time that we talked, you mentioned the importance of teaching nurses technical skills, and, like, embracing new technology. What do you have any thoughts to share on, like, what technical competencies are, like, most crucial for today's nurses, or even just the mindset that nurses can bring when approached with a new technology?
Well, I think technology and the advances that we even see today are going to be here, whether it's artificial intelligence or other new tools that are coming out that are available. I think the reality is that it's not going to go away. And I don't think that's a bad thing. I think that technology really helps us improve our efficiency. And so my recommendation would be, first of all, to embrace it. I know that it can be challenging because change is hard. Let's be honest, as adults, we tend not to like a lot of change. So my message would be to stay open-minded for clinicians that are especially at the bedside. And then my message for leaders would be making sure that we're listening to the voice of the nurse. In the academic setting, I teach predominantly at the graduate level. And so I hear a lot from my students about their experiences in the clinical setting. So next, I would say to leaders is to make sure you have your stakeholders, those that are impacted the most, those frontline users, making sure that they're in the room, that they have influence over how decisions are made before they're actually made. And then you're able to bring them along the journey, that implementation journey, so that hopefully for those that are really struggling with that implementation component, they'll have a cheerleader beside them, or they'll have colleagues in the room that they started the journey with. And so they feel more like they have more buy-in, that we care as leaders because we've listened to their voice. And then the third group of courses are going to be my nurse educator colleagues out there. Let's make sure that we integrate into our curriculum some of the information related to technology. The more our clinicians are able to actually put their hands on the technology, that's going to help decrease their anxiety, and it's going to increase their competence. So when they transition into practice, they feel more ready, they feel more prepared. And I know a lot of academic programs have already integrated a large component of technology with EMR, electronic medical records. That definitely forced so many programs to move in that direction that weren't already there. So I think at all three levels, the clinician level, at the bedside, the leadership level, and the academic level, I think we all have a responsibility to support technology to be embraced in the clinical setting.
I love everything you just said. I could not agree more. I think that historically, unfortunately, I feel like nurses have been handed solutions and been said, hey, here you go, use this. And it doesn't necessarily fit their workflow. And so instead of helping them become more efficient in their workday, it's just, it's something else that slows them down, requires more workarounds. because they weren't pulled into these development conversations prior to implementation. So I think that what you're calling out about like nurses getting involved in these conversations and nurse leaders listening to their nurses' feedback and taking that to these like tech implementation teams, I think is so important. If nurses are such a hub in healthcare, everything from care delivery, clinical workflows, patient experience, all of the documentation. I think that getting their voice involved is so crucial to a successful rollout of a new technology, whatever it may be. So I think that, what you're saying there is really crucial because it will help technology be built that actually works, and it will help reduce that barrier to change and like reluctance to change that I think that nurses like sometimes have. So I think that those are all really important points.
Yes, I agree. And then the other component I would add is when we bring nurses into the conversation, we have to make sure that they feel like they're going to be in a brave space. So that's the other part, like we were talking about previously. So we've got to establish that culture where voices are welcome, even if it's a voice that says no. I think we have to be open to that as well. And that does take a lot of work, especially when oftentimes when we move forward with using technology or integrating it into the clinical setting, there's already been conversations before it's completely implemented. And so I think we have to create that culture where it's okay to speak up, to raise our hand and say, I'm not sure how that's going to work, or I have questions. So just being receptive to the additional questions or concerns is another important element in the process as well.
Yeah, absolutely. And I want to talk, kind of looking forward into the next, let's call it the next 10 years of nursing and nursing education. I think that what we just discussed with technology is one thing, but how else can nursing education, like if there's educators listening today, what are some things they can be thinking about to best prepare their graduates for the realities of today's healthcare environment?
Well, I think that when we talk about preparing our future nurses, I think it starts with us in academia. So going back to that assessments that we have to figure out, where are my gaps as an educator as it relates to what the healthcare demands are today? And we know that there's so many competing priorities that our students have that they bring into the classroom. So our ability to really be confident and competent in our skills as a nurse educator actually helps students learn, because we have already done our due diligence. We have the experience that we're bringing into the classroom. And so what we want to do is help translate that information, that theory, into actual clinical practices. So I think the more that we can embrace evidence-based practices by bringing clinical experiences into the classroom, so we're not going to wait until students get into the skills lab until they get in the clinical setting. We're going to bring unfolding case studies into the classroom. We're going to have them bring their laptop and open it and start working with the EMR. We're going to engage with virtual simulation. So being able to bring some of those practical experiences into the classroom is essential in helping shape not only our future nurses, but we're shaping our future nurse educators, our future nurse leaders. So I think as long as we're able to really embrace and take responsibility for our self-development, advocating for additional funding, if that's what we need to help us be better educators in the classroom, is essential. And then, of course, as administrators, we also have to look at what our faculty needs are, making sure that we have enough faculty to serve our student population, making sure we have enough staff to serve our student population. I think that's a key element as well. And just like with our nurses, we want their voices to be heard at the table when decisions are made. As academic administrators, we also want our faculty voices to be there. So shared governance is essential in all areas of nursing as well. And then the last part I would add about the nursing academic setting and faculty, what I would share is that we also, not only do we have to become mentors at a higher level to embrace those brand new faculty that are coming into the academic role, we have to reflect on what it felt like for us the first time we taught, how nervous we were, especially when it comes to teaching an online course. I can still remember that. I thought, wait a minute, I know how to teach in person, but teaching online, it takes a different skill set. So that goes back to that self-awareness, figuring out what development do I need as an academician and where can I get it from and what funding do I need, and just making sure we advocate for ourselves.
Yeah, I think those are all great takeaways. If there's a nurse educator listening who feels that Dr. Sellars Educate could be a program that could really help propel them forward, can you share about like how they can find you, and also like any like prerequisites for getting into your program that they may need to know?
Yeah, so what I would say is we meet you wherever you are, and we have a service guarantee that we will support you on your journey to achieve excellence, no matter how long it takes. For me, it took almost 8 years to become a certified nurse educator because life happened between kids, going to graduate school, and just life. I didn't feel like I had a lot of support or even a community that could help me really focus on getting my CNE. And so that's the value that we bring to the relationship with all of our nurse faculty. We meet you where you are. So the first place you can find us is on our website. So drsellarseducate.com. That's where you're going to find a plethora of information. If you want to check out our blog or if you want to go to our YouTube channel, there are links there that will take you there. And then that's what I would say is just establishing a community. We have a monthly boot camp where we meet twice a month, but we also have structured programs. We have a live master class where we partner with you to dig deep into those competencies to not only help you pass the exam, but also to help you close your knowledge gaps. And then the last part I would say is with our YouTube channel. So we launch a new snapshot that's usually about 15 minutes or so every single week. We're right now at episode 205. So just make sure that you're staying connected, you're staying plugged in. We have a lot of different options for you, a lot of different resources. So we're going to support you whenever you're ready.
To learn more after today's show, you can visit drsellarseducate.com or follow on YouTube at Dr. Sellars Educate. Thanks for tuning in. Don't forget to hit subscribe to keep up with our latest episodes. And if you were inspired by today's conversation, I hope you'll share this episode with someone who'd love it just as much as you did. If you're ready to pivot your path, sign up for my free newsletter at mypivotpath.com. Get non-bedside jobs delivered to your inbox every week. And if you have questions or just want to say hi, feel free to email me at audrey@mypivotpath.com. Thanks for listening, and until next time.